Public health and its practices were forever changed nearly 4 years ago at the onset of the COVID-19 pandemic, as partisan politics and public debate clouded the scientific expertise and set an unheard of precedent in the medical community and beyond. Well, that battle is the focus of Dr. Sandro Galea's new book, Within Reason, a liberal public health for an illiberal time, that is. Dr. Galea joins me now, and he is also the Dean of the Boston University School of Public Health. Thank you so much for being with us.
Thank you for having me.
So let's talk to me about the title, because I think it's very interesting. It grabs you right away.
Thank you. I think the fundamental premise of the book is that we are going through a time which challenges some of the foundational roots of public health. Public health is an aspirational discipline. We try to build a world that allows us all to have a better life. And building that world requires an openness to new ideas. It requires a multiplicity of voices. It requires that we accept trade-offs, that we accept that we need to do X and we're going to sacrifice Y. And it requires honest conversation about those. And the thesis of the book is that we did not have those conversations, that we strayed from these liberal roots, what I call liberal roots. And by liberal, I don't mean left-leaning, I don't mean blue. I mean liberal in the Enlightenment sense of the word liberal. And we strayed from those in the past few years. And I suppose the book is trying to put a marker down and says we should think about that a little bit more carefully.
You know, you mentioned in the book that COVID-19 was public health's finest hour. Explain a little bit about that.
Yeah, COVID-19 was a tragedy. We should never forget that. More than 7 million people worldwide have died, more than 1 million people in this country. Those are probably underestimates. But many more would have died were it not for public health. Public health did extraordinary work, centrally coming up with vaccines as quickly as we did, vaccinating as many people as quickly as we did, and thousands, literally tens of thousands of people in public health worked tirelessly for 2 years to do what public health was able to do during COVID. So I start from a place of enormous respect for public health thinkers, public health practitioners. Having said that, I think it's reasonable now, 4 years after the beginning of the acute phase of the COVID pandemic, to say, could we have done better? What could we have done differently? And I come at that from a place of saying, this may happen again. We know these kind of pandemics happen. And the time to self-reflect is not during the acute pandemic. I intentionally did not write this book in 2021, 2022. I did it now because I think now that we're over the acute phase of the pandemic, it's time to start thinking about what did we do well, what could we do better, so that we can learn to do even better next time.
And vaccination became such a politically charged topic. The public health aspect of it got drowned out with the political conversation in some spaces.
Yeah, one of the theses of the book is that it became really difficult for us in public health to disentangle the evidence from the political pressures. And I'm deeply sympathetic to public health's position in this. I mean, I write about this from within public health. And I made a note in there that public health was facing a president at the time in 2020 who was governing by tweet. And a lot of those tweets were antithetical to what we knew would be best evidence. So there was a lot of reaction that public health had to react to that. And that reaction pushed us to act in what I call illiberal ways, in ways that said we needed to get to orthodoxy of thought very quickly. We needed to not really think as deeply as we should have about trade-offs. And while I understand why we did that, and while I think at the moment it's hard to reconstruct going back and doing it differently, now's the time to say, let's look back and say, what should we do differently in future? It is very much a forward-looking book, not a backward-looking book.
You mentioned the president's tweets. What role did, social media play in helping or hindering public health efforts, rather?
Yeah, and I reflect on social media. It's a bit of both. I have a few chapters on social media in the book. This was the first national crisis, just focusing on the U.S., that was experienced in real time through social media. And in some respects, this new technology intersecting with the crisis was similar, and I make this analogy in the book, to how when 9/11 happened, it was lived in real time through 24/7 cable news. It was the first time we had lived through a national tragedy using that medium, and similarly now we have a different medium. And the point is not that the medium itself has limitations. Of course it does. It's that we do not quite know how to use the medium as productively as possible. So as a result, ideas spread faster than we could vet them. Ideas spread faster than we could subject them to peer review. And the ways in which we caught on to ideas and we made them truths without knowing whether they were true or not, really took us down some paths that ended up being not productive. And I argue in the book that we need to grapple with that. We need to think about how do we communicate better? How do we, going forward, learn how to use these new technologies that are with us, they're here to stay, so that we can actually use them better in future.
What are some of those important lessons that we have learned as we talk about this book and the reflections in it being forward-thinking?
Well, I think there are many of them, but I'll just name three. And I think number one is, and you've actually alluded to many of these, number one is the solutions to public health problems is always about trade-offs. It is never as simple as saying, here is one thing and it's going to be good for everything. You know, one of the obvious trade-offs we had to make during the pandemic is how long do we keep people distanced? How long do we suggest that people stay away from work? How long do we actually keep the economy slowed down or shut down in order to mitigate the spread of the virus? I'm not arguing in the book that what we did was right or wrong. I'm simply trying to push us to ask the question, how do we reckon with these trade-offs and how can we be honest with the trade-offs? So number one is about trade-offs. Number two is separating truths, separating science from political influences. And this is really difficult. How do we separate what we knew from the science about the spread of the virus, particularly among children's susceptibility and children spreading it to others, with decisions made about school closures? How many of those decisions were influenced by political pressures from both the left and the right of the political spectrum, and separating public health from those political pressures? And number three is, how do we communicate better? How do we elevate decisions that are as grounded in the science as possible through pathways that reflect peer review, that reflect reason based on data, and are as separate as possible from the noise, the clamor that comes with social media? And I think those three things, if we can just grapple with those three, if we can actually have the conversation informed by those three, I think we'll be better for it.
I'm also thoughtful of, now we are seeing a spike in COVID cases. Do you think some of that is echoes of the past, echoes of that same polarization around the topic of vaccination, or is it folks who are just fatigued with the subject?
There is a real consequence to illiberalism, which is the thesis I have in the book, which is loss of trust in public health. There is a real consequence to that. And I think we're at a point now where it's actually difficult to engage people in an honest conversation about the pros and cons, say, of COVID boosters, because there is a fatigue, there is a loss of trust. Recently, Pew Charitable Foundation came up with their annual survey on trust, showing a dramatic decline in trust in science, trust in public health experts. And that should concern all of us. That should be something that we work to rebuild. And I argue that part of that rebuilding is by having these conversations, like the conversation you and I are having, which is, as you can tell from my words, hopefully, I'm not being dispositive about one way or another. I'm simply trying to urge us to have these conversations broadly, because that is the way for us to earn back trust, by saying we are willing to engage in how we did so that we can learn how to do better.
Do you think that there's a different level of training that folks in the public health sector have to have now when dealing around COVID and vaccinations and care and response?
I think we have a responsibility to re-examine how we teach, particularly around communication, particularly around making decision analysis, particularly about how we deal with moments of fear, particularly about how we deal with intersecting with politics and the practice of public health. You know, I have the privilege of running a school of public health, so I have responsibility for training a lot of students, a lot of people who go on to be leaders in public health. And I think we have a responsibility to interrogate all that, to examine that and say, what is it that we have learned that should change how we teach? And what is it that the next generation will need to learn that we did not know to teach the previous generation?
Dr. Sandro Galea, thank you so much for your time.
Thank you for having me.